Depression. Introduction. Depression is a pervasive and debilitating mental health condition that affects millions of people worldwide. It is more than just feeling sad or going through a rough patch. Depression can deeply impact every aspect of a person's life, including their thoughts, behaviors, physical health, and overall functioning. Understanding depression involves exploring its various facets, including its causes, symptoms, types, treatments, and the broader societal implications. This comprehensive examination of depression aims to shed light on its complexities and the importance of addressing this significant public health issue. 1. Understanding depression. 1.1 Definition and Overview. Depression, clinically known as major depressive disorder, MDD, is characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in nearly all activities. These symptoms must last for at least 2 weeks and represent a change from previous functioning. Depression is a multifaceted disorder that can manifest in various ways, affecting emotional, cognitive, and physical aspects of an individual's life. 1.2 Epidemiology. Depression is a common mental health disorder, with the World Health Organization, WHO, estimating that over 264 million people globally suffer from it. It can affect anyone, regardless of age, gender, or socioeconomic status, although certain groups are more vulnerable. Women are more likely to experience depression than men, and it is also prevalent among adolescents and older adults. 1.3 Causes of depression. The exact cause of depression is not fully understood, but it is believed to result from a complex interplay of genetic, biological, environmental, and psychological factors. 1.3.1 Genetic factors. Studies have shown that depression can run in families, suggesting a genetic predisposition. However, no single gene has been identified as the cause. Instead, multiple genes interacting with environmental factors are thought to increase the risk. 1.3.2 Biological factors. Biological factors include neurotransmitter imbalances in the brain, particularly involving serotonin, norepinephrine, and dopamine. Abnormalities in the brain structure and function, hormonal imbalances, and medical conditions like chronic illnesses can also contribute to depression. 1.3.3 Environmental factors. Environmental factors such as trauma, abuse, loss of a loved one, financial problems, and stressful life events can trigger depression. Long-term exposure to stress and adverse conditions, like poverty or an unstable home environment, also increases the risk. 1.3.4 Psychological factors. Certain personality traits, such as low self-esteem, pessimism, and high levels of self-criticism, are associated with a higher risk of depression. Additionally, individuals with a history of other mental health disorders, such as anxiety, are more likely to develop depression. 2. Symptoms of depression. Depression manifests in various symptoms, which can be categorized into emotional, cognitive, and physical symptoms. 2.1 Emotional symptoms. Persistent sadness or emptiness. Feelings of hopelessness or pessimism. Feelings of guilt, worthlessness, or helplessness. Loss of interest or pleasure in activities once enjoyed. Irritability or frustration, even over small matters. 2.2 Cognitive symptoms. Difficulty concentrating, remembering, or making decisions. Negative thoughts and excessive worrying. Recurrent thoughts of death or suicide attempts. 2.3 Physical symptoms. Fatigue or decreased energy. Changes in appetite and weight, either loss or gain. Insomnia or oversleeping. Physical aches and pains without a clear cause. Slowed movements or speech. 3. Types of depression. Depression is not a one-size-fits-all condition. There are several types of depression, each with its unique features and treatment approaches. 3.1 Major depressive disorder, MDD. MDD is characterized by a persistent and intense feeling of sadness or loss of interest that interferes with daily functioning. Symptoms must last for at least 2 weeks and include a combination of emotional, cognitive, and physical symptoms. 3.2 Persistent depressive disorder, PDD. Also known as dysthymia, PDD is a chronic form of depression with symptoms that are less severe than MDD but last for at least 2 years. Individuals with PDD may experience periods of major depression along with periods of less severe symptoms. 3.3 Bipolar disorder. Bipolar disorder involves episodes of depression alternating with episodes of mania or hypomania, characterized by elevated mood, increased energy, and reduced need for sleep. The depressive episodes in bipolar disorder are similar to those in MDD. 3.4 Seasonal affective disorder, SAD. SAD is a type of depression that occurs at certain times of the year, usually in the winter months when there is less natural sunlight. Symptoms include low energy, overeating, weight gain, and a craving for carbohydrates. 3.5 Postpartum depression. Postpartum depression occurs after childbirth and can affect both mothers and fathers. It involves severe mood swings, exhaustion, and feelings of hopelessness, making it difficult for parents to care for their newborns. 3.6 Psychotic depression. This type of depression includes symptoms of psychosis, such as hallucinations or delusions. These psychotic symptoms often have a depressive theme, such as delusions of guilt or worthlessness. 4. Diagnosis of depression. Diagnosing depression involves a comprehensive evaluation by a healthcare professional, usually a psychiatrist or psychologist. The diagnostic process includes 4.1 Clinical interviews. A detailed interview helps gather information about the individual's symptoms, medical history, family history of mental health disorders, and any recent life changes or stressors. 4.2 Diagnostic criteria. Healthcare providers use standardized diagnostic criteria, such as those in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, to diagnose depression. These criteria outline the specific symptoms and their duration required for a diagnosis. 4.3 Rating scales. Various rating scales and questionnaires, such as the Hamilton Depression Rating Scale, HAM-D, and the Patient Health Questionnaire 9, PHQ-9, help assess the severity of depression and monitor treatment progress. 4.4 Physical examination. A physical examination may be conducted to rule out medical conditions that could be causing or contributing to depressive symptoms, such as thyroid disorders or vitamin deficiencies. 5. Treatment of depression. Depression is a treatable condition, and a combination of therapeutic approaches is often the most effective way to manage it. Treatment plans are tailored to the individual's needs and may include 5.1 Psychotherapy. Psychotherapy, or talk therapy, is a fundamental treatment for depression. It involves working with a mental health professional to explore and address the underlying issues contributing to depression. Common types of psychotherapy include 5.1.1 Cognitive Behavioral Therapy, CBT. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to depression. It helps individuals develop healthier ways of thinking and coping with stress. 5.1.2 Interpersonal Therapy, IPT. IPT addresses interpersonal issues that may be contributing to depression, such as conflicts with others, role transitions, and grief. It aims to improve communication skills and relationships. 5.1.3 Psychodynamic Therapy. This therapy explores unconscious patterns and unresolved conflicts from the past that may be influencing current behavior and emotions. It aims to increase self-awareness and understanding of the root causes of depression. 5.1.4 Behavioral Activation. Behavioral activation focuses on increasing engagement in meaningful activities and reducing avoidance behaviors. It helps individuals set goals and develop a structured plan to reintroduce pleasurable and rewarding activities into their lives. 5.2 Medications. Antidepressant medications are often prescribed to help manage the symptoms of depression. Common classes of antidepressants include 5.2.1 Selective serotonin reuptake inhibitors, SSRIs. SSRIs, such as fluoxetine, Prozac, and sertraline, Zoloft, increase the levels of serotonin in the brain and are commonly prescribed due to their relatively mild side effects. 5.2.2 Serotonin norepinephrine reuptake inhibitors, SNRIs. SNRIs, such as venlafaxine, Effexor, and duloxetine, Cymbalta, increase the levels of both serotonin and norepinephrine and are used to treat depression and anxiety disorders. 5.2.3 Tricyclic antidepressants, TCAs. TCAs, such as amitriptyline and nortriptyline, are older antidepressants that are effective but have more side effects than SSRIs and SNRIs. They are often used when other medications are not effective. 5.2.4 Monoamine oxidase inhibitors, MAOIs. MAOIs, such as phenelzyme, Nardil, and tranylcypromine, Parnate, are effective but require dietary restrictions to avoid dangerous interactions. They are typically used when other treatments have failed. 5.3 Lifestyle changes. Lifestyle changes can play a crucial role in managing depression. These include 5.3.1 Exercise. Regular physical activity has been shown to improve mood and reduce symptoms of depression. Exercise releases endorphins, which are natural mood elevators. 5.3.2 Diet. A healthy diet rich in fruits, vegetables, whole grains, lean proteins, and omega-3 fatty acids can support brain health and improve mood. Avoiding excessive caffeine, alcohol, and sugar is also beneficial. 5.3.3 Sleep hygiene. Good sleep hygiene practices, such as maintaining a regular sleep schedule, creating a relaxing bedtime routine, and minimizing screen time before bed, can improve sleep quality and reduce depressive symptoms. 5.3.4 Stress management. Effective stress management techniques, such as mindfulness meditation, deep breathing exercises, and yoga, can help reduce stress and improve overall well-being. 5.4 Alternative and complementary therapies. Some individuals find relief from depression through alternative and complementary therapies, such as 5.4.1 Acupuncture. Acupuncture involves inserting thin needles into specific points on the body to stimulate energy flow and promote healing. Some studies suggest it may help reduce depression symptoms. 5.4.2 Herbal supplements. Certain herbal supplements, such as St. John's wort and omega-3 fatty acids, have been studied for their potential antidepressant effects. However, it is important to consult a healthcare provider before using any supplements. 5.4.3 Light therapy. Light therapy, which involves exposure to bright light, is particularly effective for seasonal affective disorder, SAD. It helps regulate the body's internal clock and improve mood. 6. The impact of depression. Depression can have a profound impact on various aspects of an individual's life, as well as on society as a whole. 6.1 Personal impact. 6.1.1 Relationships. Depression can strain relationships with family, friends, and colleagues. It may lead to social withdrawal, communication difficulties, and conflicts. 6.1.2 Work and productivity. Depression can affect work performance and productivity, leading to absenteeism, presenteeism, working while ill, and difficulties concentrating or making decisions. 6.1.3 Physical health. Depression is associated with various physical health problems, such as chronic pain, cardiovascular disease, and a weakened immune system. It can also exacerbate existing medical conditions. 6.2 Societal impact. 6.2.1 Economic costs. The economic burden of depression is substantial, including direct costs, such as healthcare expenses, and indirect costs, such as lost productivity and absenteeism. Depression is one of the leading causes of disability worldwide. 6.2.2 Public health. Depression is a significant public health concern, contributing to the overall burden of disease. It is associated with increased mortality rates, including from suicide, which is a leading cause of death among young people. 7. Stigma and misconceptions. Despite increasing awareness, depression remains stigmatized, and misconceptions about the condition persist. Addressing stigma and promoting accurate information is essential for improving mental health care and support. 7.1 Common misconceptions. Depression is a sign of weakness. Depression is a medical condition, not a character flaw or weakness. It can affect anyone, regardless of their strength or resilience. People with depression can just snap out of it. Depression is not something that individuals can simply will away. It often requires professional treatment and support. Antidepressants are a quick fix. While antidepressants can be effective, they are not a cure-all. A comprehensive treatment plan often includes therapy and lifestyle changes. Depression is just sadness. Depression is more than feeling sad. It involves a range of emotional, cognitive, and physical symptoms that can severely impact daily functioning. 7.2 Addressing stigma. Education and awareness. Increasing public awareness about depression and mental health through education campaigns can help reduce stigma and promote understanding. Supportive environment. Creating a supportive environment in workplaces, schools, and communities can encourage individuals to seek help and talk openly about their experiences. Advocacy. Advocacy efforts can promote policies and practices that support mental health care access, funding, and research. 8. Coping with depression. Coping with depression involves developing strategies and seeking support to manage symptoms and improve quality of life. 8.1 Building a support system. Family and friends. Building a network of supportive family and friends can provide emotional support and encouragement. Support groups. Joining support groups, either in person or online, can provide a sense of community and shared experiences. Professional support. Regularly working with a therapist or counselor can provide ongoing support and guidance. 8.2 Self-care practices. Mindfulness and meditation. Practicing mindfulness and meditation can help reduce stress and improve emotional well-being. Creative outlets. Engaging in creative activities, such as art, music, or writing, can provide a therapeutic outlet for emotions. Physical activity. Regular exercise can boost mood and energy levels. 8.3 Seeking professional help. Therapists and counselors. Working with mental health professionals can provide specialized support and treatment. Medication management. Regular consultations with a healthcare provider can ensure proper medication management and adjustments as needed. Crisis support. In times of crisis, accessing emergency support, such as crisis hotlines or emergency services, is crucial. 9. The role of society in addressing depression. Addressing depression is a collective responsibility that involves various sectors of society, including healthcare, education, workplaces, and government. 9.1 Healthcare. Access to care. Ensuring access to affordable and comprehensive mental health care is essential for individuals with depression. Integrated care. Integrating mental health services with primary care can improve early detection and treatment of depression. Research and innovation. Supporting research into the causes, treatments, and prevention of depression can lead to better outcomes. 9.2 Education. Mental health education. Incorporating mental health education into school curricula can increase awareness and reduce stigma among young people. School support services. Providing access to school counselors and mental health resources can support students' mental well-being. 9.3 Workplaces. Mental health policies. Implementing workplace policies that support mental health, such as flexible work arrangements and mental health days, can improve employee well-being. Employee assistance programs. Offering employee assistance programs, EAPs, that provide confidential counseling and support services can help employees manage depression. 9.4 Government. Mental health legislation. Enacting and enforcing legislation that protects the rights of individuals with mental health conditions can promote equality and access to care. Public health initiatives. Supporting public health initiatives that focus on mental health awareness, prevention, and treatment can improve overall community well-being. Conclusion. Depression is a complex and multifaceted condition that requires a comprehensive approach to understanding and treatment. By addressing the various factors that contribute to depression and providing effective support and care, we can improve the lives of those affected by this challenging condition. Reducing stigma, increasing access to care, and promoting mental health awareness are critical steps in addressing depression and fostering a healthier, more supportive society. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.